My name is Alexis Johnson. I'm the social media manager here at RSDSA. Tonight, I'm joined by Jim Broach, Executive Vice President and Director of RSDSA, Dr. Todd and Hess, and healthcare advocate Cammie LaValle to discuss the Minnesota Intractable Pain Bill, advocacy efforts, future legislation, and what patients, advocates, and caregivers can do to get involved in their state. I'm always looking forward to all of our conversations, but I'm really looking forward to tonight, and I hope you all are ready with all of your questions. So as usual, our guests are absolutely phenomenal. So I will read snippets of their bios, and then I will add their full bios to the chat so you can dive in and dig in a little bit later. So Dr. Hess is board certified in anesthesiology and pain management. He is a medical director with over 31 years of experience overseeing medical practices from the ground up. Dr. Hess has a successful track record of developing strong administrative and healthcare teams, and he's committed to continuous clinical quality improvement and business growth. Dr. Hess has done significant work with pain medical legal cases involving workers' compensation and injuries, and extensive work with legislative process on behalf of pain patients and providers. He has many roles under his belt, but from 1994 to 2022, he was the medical director of the United Pain Center at United Hospital and Children's Hospitals and Clinics in St. Paul, Minnesota. Welcome, Dr. Hess.
Thank you.
All right, Cammie. Cammie resides in Minnesota with her extremely supportive husband, Dan. Cammie developed CRPS in 2013 after a carpal tunnel surgery on her right hand. Like most people with CRPS, the diagnosis was not quick, and to find physicians well-versed in CRPS was extremely challenging. The CRPS gradually spread to other areas of her body, eventually becoming systemic and rendering her disabled in 2016. Prior to the surgery, Cammie operated her own consulting business, providing paralegal services to numerous law firms, in addition to contracting with a Minnesota union as a membership specialist. Recently, Cammie received a call from the Minnesota Council on Disability, informing her she was nominated for and won an Exceptional Advocate Award, which is recognition of individuals or groups throughout their advocacy, which contributed to a better life for people with disabilities in Minnesota. And I will add the link to that announcement because we are definitely proud of Cammie. So I'm going to add all of that to the description, to the chat, I should say. And as always, remember that while the information shared here tonight is helpful, please consult your physician for personalized medical advice. Now, I do have a few announcements before we get started, and I know Jim does as well. So Jim, I'll let you kick it off, and then I'll dive into a few that I have.
Well, I'll be brief because we have a very important presentation tonight. We have two walks coming up, one on September 9th in Long Island on my birthday, and it hasn't happened in 4 years, so we're really excited. Debbie O'Neill is the coordinator of it, and really want you to come. It's not just a fundraising walk, it's an expo. Come get educated, come meet others. The next day we're going down to Jersey, and it's going to be a walk there too, and we'll put up the links. And then I just want to finally say that Alexis did a great job as an editor in Rare Form on this month, June, July. It's probably the best one we've done. So Alexis, if you could send a link to that one too.
Definitely. I will put the link to our summer 2023 edition in the chat. And like Jen said, we have our two walks in East Meadow, New York, which is on Long Island, and then on September 10th, Oakhurst, New Jersey. So I'll put those links in the chat. Also, keep an eye out for our virtual conference, which is coming later this fall. And I also want to give a big shout out to the Coalition Against Pediatric Pain. It is their Pediatric Pain Week. And we have been keeping an eye on all of the kids that are at the Center for Courageous Kids this week. I will share a link to the photos and more information on how you can donate to send a kid to camp, because RSDSA does make sure that we are able to send kids to that camp every single year. So I love seeing all the pictures and videos. So enough for me. I'm going to turn it over to our guests, and of course, be sure to leave your questions in the chat.
Thanks, Alexis, as always. Great job. So
okay, go ahead, Jim.
I am just so excited that you both are here. I mean, what backgrounds, what experiences, Dr. Hess? I've known you in absentee for years. I've referred people to you. It's been fabulous. And Cammie, what a job you've done. So I'm so happy you're here, because for 7 years we have been battered by the CDC guidelines, number 1 and number 2. And we really want to talk tonight about what you can do in your particular state to make a difference as others have done in other states. And Cammie, please tell us about your role in your journey.
Okay. Well, thank you so much, Jim and Alexis. And I'm just honored and thrilled to be doing this evening. And I'd like to start by saying, you know, in the bio, it said I developed a CRPS in 2013, and I still struggle with it to this day. I am still disabled. It is systemic. I do have other conditions. And I really want to preface that the people who are listening, the listeners and the patients, you're stronger than you think you are, and you're more capable than you think you are. And I am a testament to that. I had no idea what I was doing when I started in this advocacy. And it started with seeing the 2015, the draft of the guidelines that were set to come out in 2016. And I read through them and I thought it was horrifying. And I didn't know anything really about advocating for other people. I didn't know about speaking to legislators besides sending out emails. And so I just learned as I went. And so I had to teach myself, and then I learned from others on this. There's a lot of invaluable people out there, and I have learned from some of the best. And there's many organizations out there that you can learn from as well. And so I kind of looked around and see what was going on, and I just went in head first. And if I messed up, I messed up. But I reached out to the legislators. I reached out to the state of Minnesota, the Department of Health, Department of Human Services, Attorney General's office, the governor's office, and nothing's perfect. So anybody listening, majority of people can do this. I did a lot of my work when I was bedbound. I was on palliative care. I was in really bad shape for a long time, and I had meetings while I was in bed. And I didn't have my video on for obvious reasons, but I had my audio on and I had these phone calls.
I think you should have had your video on.
Yeah.
To prove the point. Yeah. Because if we look good, then they tell us we don't have pain. So
I can't
we're screwed either way.
I did show up to a meeting with one of the legislators who ended up sponsoring our bill, which is Representative Robert Bierman. And I did show up to one of the coffee meetings, and I was embarrassed at first because I was going to miss it because I was in a flare. And I told my husband, and I may get upset saying this, but I said, just take me there. They need to see this. And it was not pretty by any means, but I can tell you it was impactful. And so that I put myself out there. And I'm not having a good day today. I will let you guys know that right now, but I'm still showing up. And Dr. Hess knows he may have to take over. So what I did is I did what I thought I could do. And it ended up being enough, but although it was years later. So I reached out to my district representatives, which was Senator Clausen, Representative Bierman. We had another representative, Jeremy Munson, who was not in my district, but he also introduced the bill at one time. And there was numerous meetings throughout the years, and it was not easy. It was frustrating. It was sometimes intimidating, but I just had to keep going. I was not going to take no for an answer. And so what I say to people is be the most, and I'm sorry for some of the language, it's not a swear word, but be the most polite pain in the ass you can be. And you have to keep going and keep moving forward. And if I can do this from my bed with heating pads wrapped around my head from intractable migraines and cluster headaches, I believe a lot of people can do this. I think people are stronger than they think they are. And I didn't think I could do it, and I did. And it wasn't just me. There's many other advocates in Minnesota that have worked on the Intractable Pain Bill, worked on these other policies. And educate yourself as far as the bills. Look at other states. There's Rhode Island, there's New Hampshire, there's Arizona, Colorado, Oklahoma. And if I missed some, I apologize.
Illinois too, we worked with this year.
Illinois, yes. and so from a patient perspective and someone who is challenged with some physical abilities, and I was still able to do this. And I really want to encourage people who are looking to get involved in advocacy and speak with legislators to try not to be intimidated by the legislators. They're humans just like we are. And I will say not everyone is going to be as nice as some of the other ones. And that's just it's just part of life. And so it's going to be discouraging at times, but if you get kicked down, you get back up. Just don't stay there. Just don't stay down. And there's enough advocates and people that around that will support you. And there's people throughout the United States that have supported me in my efforts, including Dr. Hess. And as far as Minnesota, and I know we don't have a lot of time, so I'm going to try to move through some of this quickly. So what was the catalyst in Minnesota for the Minnesota Intractable Pain Bill, which the Minnesota Department of Health and Human Services opioid work group was not acknowledging that the intractable pain statute even existed. I reached out to them and the CDC, but first, as far as Minnesota goes, I reached out to them and asked them to add an addendum to the Minnesota guidelines. They refused to do it. They wouldn't acknowledge intractable pain at all in the guidelines. It's not mentioned in the CDC guidelines, as most of you are aware. It's not mentioned in Minnesota guidelines. But we had a law. It was the only law on prescribing as far as intractable pain, but they wouldn't do anything with it. And I pushed that issue starting in 2016. And again, in 2017, started showing up to meetings with the state in 2018. And we were being blown off. So went to the legislators, and that's how we started. I drafted an amendment to that bill to address some of the issues we were currently having. And that's how it started. And other people helped with revisions and editing the bill, and worked with the Minnesota Medical Association. We had support from the American Medical Association. We had support, Kate Nicholson from NPAC, excellent organization, sent in a letter. There's many other organizations. But that's how it started. And then what really was a catalyst was Dr. Hess. Now, I believe I did a cold call to Dr. Hess. I heard about it. I knew he was, decades of experience, and he was at United Pain Center, who actually turned me away. I couldn't get care there. They said, we won't take it. It wasn't Dr. Hess. It was the clinic themselves. And so between other people and talking to some of our mutual connections, I just gave him a call. I was scared, but I called him and I said, hey, this is what I'm trying to do. Would you be willing to help? Lo and behold, he said yes.
I said,
and
yes.
He said yes. And he agreed to meet with Representative Bierman and Senator Clausen on this. And we had a meeting in November of 2021.
Yep.
And that is what made the ball start rolling faster. We did not get a hearing for years. And it was after Dr. Hess got involved and he told his side and what he was experiencing, that there was more attention paid to this. And there's not enough thank yous to suffice for what he did. And he already had a target on his back, as all pain management physicians do.
Yeah.
But he had the courage and the strength to stand up. And I'm not saying people who don't speak up don't have courage, because it is a very, the climate is awful right now.
Yeah, it is.
But I reached out to him. He explained to the legislators. And we also had help from the Burnsville City Council. Kara Schultz, a council member, where there was a 5-hour Burnsville City Council meeting. The Attorney General's office was there.
Yeah.
There were so many people that were involved in this and helped move this along. And we ended up getting a hearing in 2022 after 4 years. And so please, anyone who's doing this, don't give up. And if anyone needs help, I'm here to help you. There's other advocates that have worked on other legislation that are here to help. And so if I can do this, I believe anybody can do this. And I will offer assistance to anybody who is looking for it. And so I will say that I am struggling today, as I indicated before. And so I'm going to pass this off to Dr. Hess sooner than I anticipate.
A question first before we go.
Sure, I will,
Yeah.
I'm not gonna leave. I will answer any
Yeah,
questions.
so Cammie, how did you know that there was an intractable pain bill already on the books that should have protected you?
Well, when I had seen the 2015 draft, the draft of the CDC guidelines, I started looking, okay, what are the laws in Minnesota? What are the statutes? And I had been diagnosed with intractable pain. And so I started searching for intractable pain in the statutes, and I found the intractable pain statute was still in existence. Numerous states also had intractable pain laws. Statute
Yes.
is a law for those not familiar. Sorry if I'm using the two terms, but it's a law. And other states also had laws, and a lot of them were repealed, but some states still have them on the books. So
Yeah.
I found it, and I'm like, okay, thinking to myself, this needs to be amended to reflect what the issues are, the issues we're facing in Minnesota. It was, and I will say this, a discriminatory program for Medicaid and Minnesota care patients. Other states also have this same issue, and it's directed at Medicaid. And it was based on the MMEs, as we all know too well, that were outlined in the guidelines. And so if the Medicaid providers were prescribing over, like say a 90 MME, they get a report card, and they're being told, you know, you need to lower your patient's dose. And it wasn't, even if it was benefiting the patient. Now, I'm not on Medicaid. My sister is. My sister has end-stage Huntington's disease. She's a veteran, and she's in a nursing home, and she lives in Minnesota. I have another sister in another state who is on state assistance. So this does impact my family, even if it doesn't impact me, and it impacts friends of mine in the community. So I'm going to fight for them. So this is about everybody. This has never been just about me, but that's how I found it. I just started digging, and having a background in private investigation and in paralegal, maybe I had, you know, more of a hands up on this.
Yeah.
But that's how I started. And there are intractable pain laws out there, and intractable pain is a subset of chronic pain. It's used interchangeably. There's not an ICD code for intractable pain. So we're having issues with that.
Yeah.
But we're trying to get those addressed through the medical association and the board. And that's what we're also working on.
Yeah. And thank God you were a paralegal.
Yeah, which helped.
That did
Yeah.
help, and
Yeah.
and I did have help, and you know, I'd send the bills over, and then once it got to the legislators, it went through the MMA, went to some physicians, went to some other advocates like Laura, Amber, Tina, you know, even Kate. There's so many people were part of this. It wasn't just me, and it wasn't just Dr. Hess.
Yeah.
We're just happen to be the face of it right now.
Yeah. Dr.
You're
Hess,
also-
as you begin your talk, could you just also talk about the outside of state forces that array against you as you begin this journey?
Sure, I can let you know a little bit background. And Cammie's also tenacious as hell, and we also have a really good time together. We prop each other up, and one day I'm crying, the next day she. So we've got a really nice, and we try to have fun with this, even though some days are hell. My background is interesting. I'm an anesthesiologist, trained at Mayo, was the chief resident, went on to do what was then a pain management fellowship. So I've been doing this a long time. I built a very substantive program in the Twin Cities where we were early on with case management, early on with, you know, opioid agreements. We were some of the first in the country to go through legislatively. I worked with the board myself, the Minnesota Board of Medical Practice in the past. So was a leader, and I've been, I think, a top doctor in the Twin Cities in pain for like 27 years now. And we were horrified when we saw these guidelines, as you said, going back to, you know, 2012 as the language started coming forward, 2015. And the part about me that I think many of you know is I also have chronic pain. And so to all my patients out there, hello. First, like I said, I miss you guys. But I'm sick myself. And I think that probably changed everything. When I was in my 30s, I was diagnosed with psoriatic arthritis and ankylosing spondylitis. And then about 3 years ago, I was attacked by a dog running and ended up having ulnar nerve damage. So I had CRPS in the right hand. So of course, I knew it. Once I was attacked, I'm like, my whole thing was to see the dog's gonna either kill me or the dog. And as I'm going to the ER, I'm like, oh crap, I'm gonna get CRPS now. And so I kept telling the ER doc, just look for a CRPS, just look for a CRPS. Where's some vitamin C? Where, give me some gabapentin, give me something, because I'm considered an expert at this. And basically it was my number one diagnosis, that an intractable headache. So I kind of, I'm doing reasonably well, but that's my passion and compassion come, I believe, as a physician from being sick myself. And that's what also drove me to really stay in tune. And when I saw these guidelines, quite frankly, I was horrified. Because of the lack of data. And I think coming from, Mayo, I'm all about the data. I am a scientist first, but as a clinician, you need to follow the science. And if I was wrong, I would have walked off the stage and said, forget it, but I wasn't wrong. And then significant headwinds hit me and my program. We were investigated by the FBI, the DEA. I've been in front of the Board of Medical Practice now innumerable times. I was in front of the Attorney General 3 times now, Joint Commission. I had to, cozy up a whole cadre of lawyers. My legal fees were into the 6 figures easily. And even my lawyers were like, you're not going to win. And I'm like, yes, I am. I mean, I've done nothing wrong. If I'm guilty of anything, it's passion and compassion for my patients. And this whole MME, your MME is too high. It was literally, and I'm the pain expert. I mean, I'm on the quality committee. I do the quality work, for heaven's sake. We know that. We watch this closely. We do the pill counts. We do all these, what I think are very intrusive things for those of us who have pain, quite frankly. But I knew what we had to do, and we did it right. And I thought, well, if someone who does it like I do is in this kind of trouble, my gosh, we need help. We need protection. And we as patients need protection, not only we as doctors. So I know many of us are upset with our doctors, but let me also tell you our side of it. You lose your job. I mean, you are so heavily criticized that even physicians who want to help, and I know Cammie will back this up, just are terrified. Luckily, I had the financial wherewithal. I flip high-end houses, I farm, I have other means of income. But if you don't, you go up against all this and you lose, you're done, as you can see from the national lawsuits. So the pressure on us was extraordinary. The funny thing is my average MME was 97. And they just kept telling me, you're too high. You're too high.
Dr. Hess, just explain MNE. Just explain that.
The morphine equivalent. Basically, it's they're trying to standardize opioids, and we all know, because our livers are all different, that means nothing. I mean, they're really, it's a dosing scheme that even those of us who are against us have said they just kind of pulled it out of a hat. They kind of just said it. And so those of us who are scientists, we've got some great people out there, Chad Colas, Dr. Webster, we were all saying, wait a minute, and I think Cammie and I have always said, this has never been a pro-opioid bill at all. It's so important. We never went in saying that, but we kept saying, you've got to give us the opportunity to treat patients. If someone is completely stable on their meds, it's immoral, it's unethical to just for a number stop somebody. And especially with, CRPS, intractable headache, postherpetic neuralgia, failed low back, all the things I was seeing. I've had patients on meds for 26, 7, 8 years who had absolutely no trouble. And we were being told, you wean them. And I was like, no, I'm not. I'm not going to do it. So then I kept being taken to the board. And I don't know, Cammie, have we counted how many times I've been in front of the Minnesota Board of Medical Practice? It's almost like, hey, it's Todd. Hey, guys, it's me again. How are you? Yeah.
Could I have my seat back?
Yeah, grandkids are a little older now. Sophia knows how to do an iPhone better than I do. It was kind of like old home week. We have old home bread here in Minnesota. And it was getting to the point though, and even my attorneys just kept saying with all these things, especially the Joint Commission, and they kept just telling me, and I'm like, no, I'm fighting. I am fighting. I am not going to settle, because I went to Catholic school. If I did something wrong, I am the first to admit it, not the last. I have that. And also working farms as a child, I'm not going to give up. And if I was wrong, and so I looked, I had everything looked at it, and my lawyers too were like, look at those numbers. And I said, those numbers mean nothing. Look at her arm, look at his leg. Do you know what CRPS is? It's a suicide illness. And it was funny, each of the patients they put in front of the board with me, my dear sweet patients who know I love them, I told them, I said, well, I'm being investigated. And they're like, for what? I said, well, for helping you. So I had wonderful support with my patients. They knew what I was up against. And when I went to the board, that's what I said. I go, I know he who's without sin cast the first stone in, but please tell me my sin. If it's my sin of compassion, guilty. But if I've done anything that was immoral or unethical, then I really need to know. And in the end, I had a legal team, by the way. And it's so funny that kind of D-Day came, in front of all the stories endless. He's so funny. He goes, "Are you sitting down, Dr. Hess?" And I said, "I rarely sit down, but what's going on?" He's like, "Well, you just won the World Series, the F1, the Formula 100, you won every major sporting event because they found nothing." And I said, "I told you that 3 years ago. I mean, I'm glad you guys are dancing the jig, but I knew." So in all of this, a lot of things happened, not very good. I was in a pretty low spot. And all of a sudden, some little Cammie LaValle, as they all mispronounce LaValle, called. And I thought, oh God, who the hell is this? And and she was quite tenacious with me and an old friend, Al Anderson, who was, the president of the American Pain Society.
Yes.
Al's a great guy.
Mhm.
Al said, call Todd Hess. So she calls Todd Hess. And I'm like, I think it was pretty quick. I said, oh, hell yeah, I'll do it. What do I have to lose? I mean, I just went through, all this. I'm going through all this. I mean, I want to tell my story. So we met one cold day in November in Apple Valley or Lakeville or somewhere at a Caribou Coffee, which was only supposed to be a short meeting. And we had two wonderful, wonderful advocates at one state legislator House and one Mr. Berman, and then Mr. Clausen. And I told my story. No hyperbole, just flat out what was happening with me. And they literally were like, what? I said, yeah, this is what it's like to be a pain doctor right now. And I'm up in front of the board. I'm in front of the Attorney General. I'm in front of Joint Commission. I'm at, the FBI, insurance. I was decredentialed, And he just was like, with your CV, you? I said, hey, I'm just telling it straight. All I want to do is be a doctor. I was not here to make trouble, but I've got to support my patients. And then I told them my personal story about my personal pain. And I can tell, Cammie, you could just see it. And they asked me really pointed questions. It was not all fuzzies and hugs and love like we in Minnesota, as Garrison Keillor says we do. We're actually pretty brutal with each other because they wanted to really root me out and see if I was just some other, ding-a-ling, pill mill doctor, which we all get accused of, which the vast majority of us are not. And that's really left a chill. We took care of that as pain societies 2012. It isn't like we sat around and did nothing. We were reporting this. We did reports. And 2016 made us sound like us pain doctors did nothing. In fact, they tried to say, during the guidelines, this isn't all about pain doctors shouldn't be writing our guidelines. Well, we were pushed out. Like us board certified pain specialists were kept out of the equation. Psychiatrists and addiction people wrote the pain management rules. And I think the senator said, I just told them what was happening. And then that really started things going. I think, Cammie, that's where the wheels, and then Cammie taught me. And then we have to really call out Kara too. Kara is the city councilwoman for Burnsville, who was the one city in the state of Minnesota that was not going to take the big pharma money. And she held the whole thing up, and it became a huge show, didn't it, Cammie? It was big. And
it was, yeah, I want to mention the
That was
reason of that. Because in the memorandum of agreements, and most states, it's like a template, but in the memorandum of agreements for the state of Minnesota, what they did is it wasn't about them not getting the funding. We know that there's people who suffer from substance use disorder, and whether
Absolutely.
that's, an opioid or whether that's legal or illegal or alcohol, we know that there's an issue there. So it wasn't about them not getting the funding. It was about what was in the memorandum of agreement.
Exactly.
And in reviewing the memorandum of agreement, there was language in there that the regulations for the state and the policies had to be consistent with the CDC guidelines, which were already problematic and at the time were already being revised.
Yeah.
And so that's
We
the
had been
stance
arguing
that
with
she
them.
took.
Yeah.
And she is a cancer
brilliant.
survivor. And so she
Yes.
educated the Burnsville City Council, and she gave us an opportunity to also educate the Burnsville City Council. And what they did, which I found was just excellent, because the city I live in, they just had it on their consent calendar. There was no meeting, there was no discussion, you didn't even know about it. And so the city of Burnsville opened up the forum, and this was for people like myself, who have a medical necessity for these medications. This was for people who were suffering with opioid use disorder, any type of substance use disorder. This was for parents who've lost their loved ones, legislators, the Attorney General's office. I mean, there was a big crowd.
It was a
and
packed crowd.
Lots of people talking. I believe it's about 5.5 hours long.
Yeah, it went long.
And so she had stood her ground and tried to explain these guidelines are dangerous. They're causing problems. People are being cut off. They're taking their life, or they're going to the street, or they're turning to alcohol. So our concern was the language in the memorandum of agreement. To be very clear, that's what that was about. And they wanted to, in the language in the memorandum of agreement, which if anyone has questions, I'd be glad to share some of the memorandum of agreements through other states and through other settlements. But they also wanted to kind of double down on the surveillance and the PDMPs, which as we know, the majority of us know they're being weaponized already.
Absolutely
and data
weaponized
mining.
Against the patient and the doctors. Absolutely.
Yes. And so
absolutely.
that
was terrifying.
Why she took a stance, and I'm so glad she did. And she gave us that opportunity. And during that, there's a legislator there, Representative David Baker, and from Minnesota. And I can tell you, and he would also tell you if you asked him, I don't know if he's watching this evening, he tragically lost his son to an opioid overdose. Now, I do not know the details of what happened. He lost his child. And he is a representative in Minnesota, and he was one of the main people behind the opioid legislation in Minnesota in 2019. Now, when we started, we were on opposite ends of the spectrum on how we viewed things. But I could understand. I can't understand losing a child like he did. I can understand losing a child because although a miscarriage is not the same, but I can understand losing a child, but not in the way he did. But I could try to understand his point. I do also advocate for people suffering with opioid use disorder, any substance use disorder. And we ended up coming together in this last 2 years, and he fought for this intractable pain bill.
He actually fought with us. It's one of the things I wrote on Advocacy, Cammie, was build coalitions. And I think the one thing I learned from that, because he and I were there the first night, and it was like two dogs growling at each other. I'm the doctor, the patient advocate. Cammie and I both, gave impassioned speeches as to, with Kara's support. And he even met me in the parking lot because I'm a farmer. He's a farmer. He said, look, I said, no, we need to work together. I get it. I'm sorry for your loss, but compounding that loss with more loss just doesn't make sense to me. I mean, I lost my dad tragically. We just really need to come together. And I think that was part of the thing, Cammie. We have to deal with all the legislators as much as we can.
Yes.
This isn't Republican. This isn't Democrat. This isn't, libertarian. And this is what I do well, because I'm able to speak to all sides. We have to do this. And I think that was one thing Cammie and I have learned. I think that some of the points we need to tell you is that, you build coalitions, and what do they say? Politics makes strange bedfellows. I mean, I have learned so much in the last 2.5 years about how we need to build coalition. We need to educate and tell our story kindly, compassionately, passionately, but not angrily. I think you otherwise you don't condemn, you educate, you lift up. Now we as pain patients and pain doctors have every reason to be screaming. God bless our patients. I mean, the suicide rates and the horrible things. But we're not going to get a lot done if we go scream. We get more done by these, you know, and Cammie and I, we've done how many different meetings, how many different, you just keep hammering the data. Even just recently in our last session, Cammie, one day, I'm like, Cammie, just shoot me. We had all of this set up, and then the whole damn thing unraveled. And I just was shocked who was not my friend this session. And Cammie talked me off the cliff, and we ended up coming back around. We had a private side discussion. It's kind of fun to do, Cammie, isn't it, as a team, because we have each other to lean on when things, because it's really, you know, in medicine, there's a diagnosis, a treatment of this. With legislative, it's not that way at all. It's dealing in this and that. And this isn't the world that us docs usually are in, but we absolutely need to be. And like Cammie has said passionately today, we have to show up, and we have to be there. Yeah.
Let me take us back to.
Go ahead. Yep.
The bill's passed. What's happening in Minnesota now? Is it utopia?
We met with Ms. And this is why we have two. Robert Bierman is honestly should get an award too. He has been absolutely a godsend for the pain communities. He's in one of the suburbs of Minneapolis. We talk a lot with him, Cammie and I. And even after we passed it, he even said, this is just the beginning, isn't it, Cammie? And he jumped, and we all just sat there, and, you know, we were happy and hugging, but we all knew this isn't going to just, because there's so many forces against us, Jim. And, you know, there's been a hit piece done on me in the paper. Cammie's we have enemies, which I don't understand. We love our patients. We're here for the right reason. We agree that there's an SUD problem, but yet we're singled out because we're trying to do what's right. You know, the AMA supported us, MMA supports us, but we've created enemies. And I don't get that. It's all about the patients. But we know it's not utopia.
If I can step in here, one of our issues is we went up against the state themselves. And I will be brutally honest here. And you know, the Minnesota Department of Health and Human Services did not want this to go through. And
not at all.
They did make some concessions, and there was an agreement, and some language was removed, and we had to add some language. But once it got through, and then it, you know, ultimately passed, we did lose some language in one of the finance committees when there was no fiscal note to the bill. So a finance committee and one of the one of the sponsors wouldn't even stand up for this. And this was language that was supported by the MMA and AMA. But after the bill had passed,
I needed shock treatment. I was so upset. I'm like, are you kidding? Who's my friend?
It became effective August 1st. And so then what we started to do is we wanted the medical board to put out more information on it, put it on their website. The MMA has put out a few things on it, but the state has not. The Department of Health and Human Services, you cannot find a link to the intractable pain law anywhere. You can't find it because they just won't do it. So that's part of the things you have to keep working on. You still try to get it out there. But but it has helped some people. So what I tell people to do is, if you've been diagnosed with intractable pain, or you have a condition and it meets the definition of intractable pain per the law in Minnesota, because there is no ICD code for intractable pain. So what I tell people to do is print out the law, know what it says, also what it doesn't say, because some people had a misunderstanding that, everyone can be prescribed. That's not what it says at all. It protects people, especially protects the providers, especially for that Medicaid program, the quality improvement program. It protects the patients from being force tapered solely to meet that MME, which is that morphine milligram equivalent. And so there has been some success in that, and some of the patients have taken it to their providers and said, okay, can you read through this? You've diagnosed me with intractable pain, and I know that because you also gave me a certificate to use, like in Minnesota, medical cannabis. And intractable pain is separate from chronic pain in Minnesota for the medical cannabis program. So they need to go and get certified. So these patients who have been certified, including myself with intractable pain, which the state accepts, you've been certified as having intractable pain
Intractable
or a
pain.
condition
Yep.
that meets the definition. And so they've taken it to their providers, their clinics, including myself. I did this. My physicians at the time knew exactly what I was up to, and they supported me the whole time. And so they've taken it, and some people have been successful in getting their doses back to where it did benefit them. Now, this isn't
Yeah.
just about everyone should have an opioid, because I don't agree with that.
No,
It's
we
not good
never
for
said that
everybody.
either. We never
No.
said that. It was never an
Um,
opioid bill.
As far as the pharmacy goes, there's been people who have had to take it to the pharmacy
Yeah.
because there is a provision in there
So
where they can't
frustrating.
deny it solely based on the MMEs.
Exactly.
And so that has helped. But has it
Definitely,
helped everybody?
and definitely know
No.
that. You patients know that. You have the right to your medication. So if there is a hassle, let somebody know. Take it with you. And that's one point that Cammie and I really wanted to get across. I hope there's some physicians on, and I'm more than happy to talk to them also. But there is this enormous fear, Jim, of retaliation. Hello, here's the face of retaliation. So I'm no emboldened now. And if even if a doctor, a nurse practitioner, or PA, and Cammie will tell you, we have wonderful clinicians who are absolutely terrified to speak up because there is retaliation. Us patients are being retaliated against. The stigma, you're an addict. I've been called an addict, for God's sake. I mean, it's like, come on. But we have this stigma about having chronic pain, which we all need to work on. And that's what I'm going to dedicate the rest of my days to, is educating about what pain patients aren't. I'm also the face of pain. I live with chronic pain. So the more we can come out about it, the better. But if you are afraid, pass the information to us. You can pass it anonymously to a legislator. You don't have to use your name. But the more info we can bring, and if you would use your name, Cammie, we would love it. Cammie and I are constantly saying, say something, do something, talk, show up, listen. But if you're too afraid, tell us and we'll do it. But if you're not doing anything, then you're part of the problem. We as pain patients have to fight for our life. We shouldn't have to, but we do. So even like Cammie from bed, do a letter from bed. There's no reason you can't do something. Call us, write us, tell us. And I think, Cam, that was one point we really, really wanted to say, communicate. If you know of someone committed suicide, start writing the names down. Cammie and I have the data. We're keeping data. Who's been ripped off. Cammie has some data from Minnesota. People were just literally stopped. That's not even medically sound to do. We need to know. But if you don't tell us, you're not going to help us, or you're not going to help yourself. So please, let's get someone, empower, find out who the power structures in your state, and do something about it. One thing I did learn, Cammie, and you taught me, one voice does make a difference. Cammie, LaValle, and find a legislator. They do want to listen. That's one thing I was really surprised, that I was a little timid with my personality, but it's amazing, Cammie, don't you think, how they wanted to hear from me? Wouldn't you agree?
Yeah.
Yeah.
I wanted to just bring in one boogeyman we haven't talked about, the DEA. So when I've talked about your valiant efforts here and elsewhere, they always talk about, well, that's for the states, and there is this boogeyman that is federal.
Very well aware
of
this, and federal supersedes state, and we're aware of that. And
we need a national policy. We need a national policy. There's absolutely no question, Jim. And we want this, absolutely.
Yeah, there's
Is
people
Kate Nicholson working on a national policy, or any other advocate groups?
I can't speak for her, but I believe that there's been.
We are all trying.
It's my understanding that there's efforts going on, and there has been efforts going on. I've also tried to reach out, but I mean, she is far more well known than I am. She's an attorney. She worked on the ADA. I mean, she is the upper echelon of advocates. She
really
is an excellent person. Her organization, I would tell people to reach out. It was noted in your newsletter. And I do believe that she is working on this along with other people. And
Yes.
but I can't speak for her.
Well, and then,
Right.
we have like the
but-
law firm in Detroit that I was working with, Ron Chapman. Ron has done a lot. He's a good resource from Detroit. I'm one of his consultants. I think, there's avenues here, but I think that you bring up, I love that you brought this, Jim. Here's the point. There are 50 to 100 million Americans with pain, even though they keep trying to lower the numbers. What if we all came together like cancer patients do and just say, we've had enough, and then get our family members involved? So you patients, you have one family member who is your advocate. Let's do this. We can. Let's stop infighting. Let's quit talking about who has worse pain. It doesn't matter. We have pain, but we have got to do something this, and it's not going to just happen. We have to get in our beds or off our butts or whatever, but we're a huge force. Now, again, CRPS, you're a small cohort, but when you look at all of us with the autoimmune diseases, fibromyalgia, arthritis, CRPS, PHN, I mean, all these, we need to come together. I'm glad we have, the subgroups like you guys, because you have special, needs and interests, just like the other groups. But as a super group, look at the power we would have, you guys, if we got together. Let's do it. That's a
We
lot
play
of
well
people.
in the sandbox, so we're game.
Me too. Let's make the biggest damn sandbox and show the world, and let's come out. Let's show who we are. I am a pain patient, okay? I'm not an addict. Again, I'm not, stop this stigma. We just need to educate. Stop the negative. Chemical dependency, substance abuse is also an issue. We need to work together, but that shouldn't, if there's a 1 or 2% addiction rate, that shouldn't keep the 98% off their meds. It makes no medical sense. One of my med school professors went, that doesn't make good metabolic sense. Okay, that does not make good metabolic sense. To cut people off, it's cruel, especially when they're following everything they're supposed to do. And we can't sit back any longer and watch this. We just can't.
And generally, there's no game plan once they're forcefully tapered. They're just.
Oh yeah, no, deep breathe, Jim. Deep breathe. That's what we do when we have a lot of pain. We just deep breathe.
Some people do well from tapering. We're not saying nobody should be tapered. That's not what
Try it,
we're doing.
but
But
forced,
when someone's
but not forced.
when someone's benefit outweighs the risk,
Sure,
and
try it.
they're stable. And as far as the law in Minnesota, and this is why that when I hear it all the time, the state laws don't matter because of the DEA. Yes, I know the DEA is there,
but they do matter.
But as far as Minnesota, there's a provision that says they can't taper solely based on an MME. Now, let's say the federal government comes in and they try to, go after a physician, and they try to say, okay, well, you didn't taper your patient. You didn't bring your patient down. Someone in Minnesota, a physician in Minnesota can say, I was following the law in Minnesota. Now,
exactly.
Can't say that's going to be the best defense of all, but they are following a law.
We're starting to have a safety net, at least. Go ahead.
Even though federal supersedes state, I strongly believe the more states who have some type of legislation, and whether it's the law or whether it's policies within your state health and human services,
we have to start somewhere. We have to start somewhere. You have to start somewhere. I know we get pushback even in the pain community. Well, what good is this going to do? I'm like, after we've spent 2 years of our lives, Cammie spent how many years? I've spent 2 years, almost full time in my life right now. Give us a kudo and say, hey, we're trying. It's not going to all happen at once. I mean, but we've got to keep the energy flowing. Like Cammie and I already have an agenda for next year in Minnesota. We're again wanting to be an advocate for the whole country, though. We don't want to be just Minnesota centric either. We want to be worldwide. I mean, I worry about global pain, for heaven's sake.
Yes.
My God, look at, in parts of Africa, I did mission work where there was basically not, you couldn't even advocate for anything. Almost how the US has become, where even cancer patients are not getting, they might get addicted. They have 3 days to live. I mean, that makes no metabolic sense at all to me. I mean, but nor should someone with CRPS live their whole life in pain if they've proven. And again, Cammie, you made a good point too. Also, tapering is not a bad, for some patients, it's
Yes.
but it should be a relationship thing,
Yeah.
like the
With
work out in
permission.
Stanford. Well, like out in Stanford, Beth Darnell. Beth's got some great ideas. I mean, and it's always the lowest dose that still works. I mean, you don't want to be on doses where you can't think, but it's always good for the doc and the patient to kind of figure out but not to be told because of a number that has little or no scientific evidence. That's wrong.
Yeah.
Period.
I'm just going to stop us now and invite Alexis back with maybe questions from our community.
You bet.
All righty. Yes, I've definitely put in a call for questions in the chat, and we have a few that have popped up. So I know some of the questions you've touched on, but I know people join the live at different points of the live stream. So just want to add that note. So one of the questions someone asked, do you know if anyone is working on this in Missouri? And I'll even expand on that question, not just Missouri. I mean, there's people from all over the country on this live. How do they get in contact with, the Cammie and the Dr. Hess in their state?
Yeah.
Well, what I would say is, I don't know everybody in every state that's working on something, but I know that there are different support groups, and there's groups that are working on legislation. One of the organizations that I have done work with and collaborated on a survey, which I believe is going to be shown as far as patient abandonment and forced tapers, is a doctor-patient forum. Don't Punish Pain rallies. They have
Yes.
Facebook pages.
Yes.
And I believe every state has one, and I believe it's also in some other countries. I'm not officially affiliated with them, so I can't speak for them, but I do know that their state Facebook pages, and I do know that many of the states are working on legislation. So I would say seek out, one of those pages, or follow, the NPAC, and look out and see what other states are working on legislation. Reach out to
Cammie,
people like
do what you did.
Tamara.
Yeah, do what you did. You do what you did. You called me. Talk to your pain doctors. See if there's a pain doctor or a pain nurse practitioner or a pain PA that again, form a coalition. Bring them passage up and just talk to a legislator. Even if you don't know, like you did, Cammie, we just met with a legislator and then kind of figure out. I hate the way you say who's on our side, but who understands our situation, and
who's willing to listen.
Who's willing to listen and take that risk like Cammie did, who was afraid to call me. She found out I was actually a pretty nice guy, I think, didn't you? Cammie.
He's a farmer.
Jury's out.
I'm offering help to people. And I am not, I'm not an attorney. I'm not a medical professional. Like I said, I was winging this in the beginning, and I've educated myself, and I've had a lot of help along the way. And I can't stress that enough. If people are offering you assistance, take it.
Don't stay silent. Again, please don't stay silent. Don't stay silent. Speak up.
Look at your state guidelines. Look at research what is been put in place and see what needs to be addressed. Look at other state bills that
look at ours.
Passed.
Absolutely.
Alexis, have we put the linkage to the bill in our chat? I'm not looking.
I know Colorado, other states, we're more than willing. This is not proprietary. We want to help. This is absolutely there for the taking, and make it better, and then we'll bring it back. We're not done.
We're not all that in a bag of chips. We know that there's people that are far
more to do,
better at this than we are, but we are putting ourselves out there to assist if someone wants assistance. And we're willing to share the information on what we faced in Minnesota, some of the challenges, what worked for us. Petitions worked well because some people don't like to write out an email or are intimidated by the process. And so it worked in Minnesota is as a petition to support a bill or petition to get a sponsor for legislation. And so there's so much that we could address, but there's just not enough time. There's never really enough time. And that's not anything against you, Jim or Alexis.
Hmm.
It's just, this is
lot of
a
work, actually.
complex
It's a lot of work.
issue. And
Absolutely.
I will, again, say that I'm open to any questions. People can email me.
Same here.
And I will again say that we are not pro opioid. We are,
No.
when it's medically necessary and the benefits outweigh the risk for that specific individual.
Yeah.
In my case, I've
so important.
exhausted everything, including crazy 9-hour infusions of, I don't even know what it was. Salumedrol, magnesium, 9 hours. I got extremely ill. I've had my arm in a sandblaster. I've tried every medication under the sun. I've had nerve blocks that made my CRPS spread.
I think that's important, Cammie. What we did too is we all kept saying, again, believe you me, physicians take no joy in writing opioids. I mean, but it is a tool though, that if we don't, how can a pain doctor not have that tool? It's like, if you're a diabetologist, oh, you write too much insulin. Oh my God, what are you doing with that insulin? Well, I'm a diabetologist, but I'm a pain doctor. Of course, I'm going to write opioids. I mean, it's just part of the job. And for a pain doctor to say they can't write opioids, that's not acceptable either. I mean, it really isn't.
Yeah,
there's a
in my
balance.
opinion.
Quick
We have to
question.
find the balance.
Gotta be
I
balanced.
hear from people from all over the country.
Yeah.
This week, I heard from 2 people who were elderly who were refused opiates because they're not good for the elderly. Any data?
Oh,
God, don't do this to us, because there's so much misinformation. It's all about the dosing. It's all about, and it's what's the disease state. I've had 90-year-olds. Again, you may use something different. Certain things may be better than others, but it's just another one I get is children. Oh, children don't have pain receptors. And I did do children work. I'm like, are you kidding? I mean, I've worked with children, that's a whole nother thing that just literally will set me on fire as an anesthesiologist. So just let me do this. And I want to put a plug in, because my group, the ASA, has been great. The AMA understands we've got good medical backup, but we need now the legislative backup, who really, I don't think should even be involved with this, quite frankly. This is a medical problem.
Yes.
But we have to deal with them, and the insurers, we have to deal with them. But to not treat, to me, is unethical. It does not follow practice, and it's not even good metabolic sense, because treating pain can actually lower the pain and you move on quicker. Now, giving 90 tablets for a little foot injury, no, we get that, and we've done some great things, Cammie, and we've shown that. I mean, taking some of the opioids up, but we've also seen that even though we've dropped the opioids prescribing down exponentially, the overdoses have gone up. So clearly it's not working. What they've done is not working. And we need common sense back here. But to not treat, I can't watch it.
Okay. Alexis, we're bogarting. Any other questions?
No, so this next question actually has to do with what we're on now. So someone was asking, how do we tackle the production problems with opioids?
The production, you mean the manufacturing and the quotas?
I'm assuming that's what they meant. That's I'll see if they follow up with that.
Each year.
Yeah, and we talked about this. We bring this up. Again, we didn't start the fire. I mean, when you look at the literature, this was not physician driven, but in the end, they just keep saying that, and they just keep squeezing. And Cammie, all of us, it would be interesting if I could see everyone online to raise their hand how many people had trouble getting their refill. I mean, I would say all of us there, and then you get the stare down, the pharmacy stare down, and we don't have it, and it's 1 minute before your refill. Oh, we ran out, so we can't get it for 3 days. I'm like, 3 days? That's going to put in withdrawal. I mean, it's just literal, constant. And so I think again, we probably, Jim, it's probably legislate. It's again, call your legislator. Mr. Bierman wanted to hear about this. The more patients who call. Again, if there's 50 million of us, even if you're not on an opioid, if your friend is, call for your friend and say, look, my friend is withdrawing every month because of this silly policy. Again, we need to get together and fight with each other, not against each other in this. And again, I think it's all back to legislate. I don't think there's going to be any other way. Cammie, what do you think?
I think there can be reports made to the Board of Pharmacy as far
Yep,
as the
put the reports.
shortages.
Yep.
I think
Report.
a report can be made to the FDA.
Mhm.
We do know that obviously, we know that the settlements and some of the settlement language is that they no longer can manufacture, and there's a few manufacturers that are involved in that, and then the DEA has obviously reduced the quota. And so I don't have a perfect answer for that, but I know something has to be done, and I do know
We need to
that
just keep pushing.
Senator Klobuchar, one of the U.S. senators, had spoke about the shortages in
Critical med
medications.
shortages. Yeah.
Um,
Because of
she
chemotherapy
didn't-
too right now. I mean, it's unbelievable.
Yes. She did
We-
not mention opioid analgesics, which is not surprising to me. But that is, since she did open that door and is talking about it and the shortage of the medications, we can reach out to our Congress, and I have been
Please
doing
do.
that, and I plan on
Please do.
continuing. I don't have the perfect answer for that question. I've had to wait for prescriptions. There is a shortage of medication throughout the United States. It's causing a lot of problems. It's causing suffering. It's causing suicides, and we need to do something.
And it's
so
real. I think that's, again, Cammie, we've had to change meetings because you had to think around with your refills. I mean, we've all
Absolutely
experienced
real.
this.
Yeah.
This is, and I think take this to your legislator, show them how real it is. And again, go with passion, compassion, education, not screaming and hollering, but just show the impassion what is going on. Come on, we can do better. Work with them. It's really important to educate what's really happening, Jim. And unless people speak up, Cammie and I, if we don't have numbers, they'll look at us, oh, I remember that one legislator, well, there's no problem. I'm like, what?
No problem in his household.
See, well, no, this is what's funny. This is something, let me tell this, Cammie, where we had met and we had doing some things. And it's so funny how many, after I meet with the senators and legislators, are like, would you see one of my family members? They have chronic pain. And, so almost every meeting we went to, didn't we, Cammie? Someone's family had a pain problem. And I was like, well, then vote for my bill. You empower me, I will see your family member. Because, it's like, come on.
Well, you didn't actually, it wasn't actually like that. Try to be clear here. It wasn't like a
no
tit for
deal.
tat
Yeah,
thing.
but it was a metaphor, but it's like we were joking,
Yeah.
saying, well, if we don't have the tools, we can't help you. And this is exactly why you need to listen to us so that we can, get some things moving. Yeah, exactly.
Yeah, Cammie, people get impeached for that kind of.
Yeah.
Oh, you think? Yeah. No, I'm just.
That was a joke. Yeah.
No, and that's why I wanted to preface that and reiterate. I mean, we talk off the cuff sometimes, and
we laugh a lot too.
We can be as formal as we need to be, and we can be informal.
Yeah.
But
I think we were both impressed how many legislators had family members with chronic pain. When you look at just the sheer numbers of us, Cammie, that's what we kept saying too. It's we're a huge cohort. We really are. Of the top 10 diagnoses that people go to see a doctor, pain is between 4 and 6. Pain is ubiquitous. So we should have massive coalitions going at this.
Right.
Yeah.
Alexis, take us away.
Well, I will say I did share your advocacy helpful hints in the chat because.
Thank you.
Yeah, so I did share that, and I will make sure that they're in the description of this Facebook Live as well, and whenever we put this on YouTube. So definitely be sure to share this with your folks who do not have Facebook. So we have a couple more questions, and hopefully I did try to see if I can get some more details on these questions, but someone asked, how do you get certified? I'm not sure at what point during the live she asked that question.
Okay, I think I know what that's in reference to.
That's state by state too,
I think that has to do with, because I use the term certified for the Minnesota Medical Cannabis Program. I don't know, I can't see if that is actually what they were asking about, but that's when I used that term. And as far in Minnesota, for the Minnesota Medical Cannabis Program, you can Google Minnesota Medical Cannabis. The state is Department of Health, and that'll come up, and it'll tell you the steps to go through. Actually, yesterday in Minnesota, recreational marijuana, cannabis is legal.
Yeah.
But there's no dispensaries. There's one, and it's on a reservation, and the rest are not going to be. I mean, reservations, they have different rules.
Yeah.
They don't have to
Sovereign
follow
nation.
the rest. But some of the reservations do have the dispensaries, but as of yesterday, only one was open. But for the medical cannabis program, you can look it up, research it, talk to your doctor about it, and ask them, do you think I'd be a candidate for this? For me, it doesn't help with my pain, but it does help with muscle spasms, and it helps, sleep. So I only take it at night. But it does help other people tremendously. And
Sure.
some people have actually, gone off the opioid medications and other medications and are only on medical cannabis. Unfortunately, that didn't work for me, but we're all individuals. But
Yep.
So in Minnesota, you can look at the program, talk to your provider about it, and see if that's going to be a good plan for you. And in Minnesota, if you're in the medical cannabis program, you don't have the tax. They're not taxing you as far as like the recreational marijuana or the gummies or the tinctures, things like that. And so your physician should know. If they don't know, then you could introduce them to it, but always talk to your provider. I would say even if it's legal, it could be legal, but it may not mix well with the medications you're on. So always talk to
Yes.
your,
Always ask.
and Dr. Hess would probably be a better person to say that, but
Yeah, we
you
just
should always
absolutely
inform your physician.
drug interactions. You
It's
just
kind of a
need-
topic for another.
exactly.
topic.
Yeah,
But you
Be
can
happy
get
to.
the certified has to do with a qualifying condition, and that's how the Minnesota
Yeah.
program is run. And that's the terminology they use in their program to
And
get
each state is
certified for the
different.
qualifying condition.
Yeah.
There's not an
Okay.
actual certificate. So I
Mhm.
hope that answers the questions. And if someone, you can give my email out, I can answer questions at another time if you'd like, and I'm willing to walk somebody through the process.
Thank you, Cammie.
Absolutely. And if there's a minute, I would really like to say something. We were, I'm sorry, let's finish the questions and then I can maybe put something in the chat.
Well, I think these two questions have already been answered. Hopefully I didn't miss them. Someone was asking, how can I get this started or change the syndrome to disease in their state is what someone is asking.
Oh,
Syndrome to disease. I'm
Yeah.
not sure what that.
so from chronic complex pain syndrome to a disease state. Yeah, syndrome versus disease. It's a medical. Yeah,
That's kind of an IASP question.
it
Yes.
is actually. Yeah, it
Yeah.
is, because we all know it is, but it just, the nomenclature is what.
Yes.
And again, just like we didn't even have an ICD-9 code for intractable pain, which we were held against. So that needs to be updated. Absolutely.
Good point.
I
Sorry
can't.
about that. I'm on
We
mute.
didn't hear you, Alexis. Yeah,
Sorry about that. Someone else was also asking about getting certified for intractable pain as well. Yeah, someone said I never got certified for intractable pain, but the doctor who certified my MMJ agreed I had intractable pain.
Yeah, it needs to be a document in Minnesota, but it should be one of the conditions. So, CRPS, intractable pain. We're just when you meet the criteria for the diagnosis, your doctor should put that in the chart. Absolutely. Yeah.
And
Very
if they don't think you have intractable pain, or if they
Then
don't think that your condition
it
meets
is.
the definition, you
Yep.
can't really force it upon him.
Nope.
But there's also many physicians and providers that didn't even know about the intractable pain law.
Exactly.
And
Yep.
being as there's no ICD code, they don't really,
That's the problem.
there's
Yes.
not that diagnosis. But being as in Minnesota, the medical cannabis program specifically
Yeah. Points that out.
indicates intractable pain, and it's separate from chronic pain. That's why in Minnesota, I'm talking about it different.
It's so
And
important to put in the chart
You can get
when you meet the criteria.
certified when you meet the criteria. So it's not just, hey, can you diagnose me with this? It's a, if you have it and it meets the definition, then you talk to your physician about that
Get
to
it
make
in your
sure
chart.
that your diagnoses are in your notes. Because even if it can't be a diagnosis code, it can be noted in your medical record.
So your problem list.
I hope that answers the question.
Yeah, so I will also say that the two of you have a lot of fans here in the comments, a lot of people who are saying that they miss you and that they are really enjoying this. So once I send
I'll
you the
start.
link, you'll see it.
I miss my patients so bad. God bless you guys. Honestly, there isn't a day I don't think about you, but know that I'm well.
Yes.
Switching gears a little bit here for now. So
I
Quick
know we're
question to
over.
you. Are you teaching in middle school and medical schools?
I've really had to take the last year to try to kind of figure out what I'm going to do. There's a lot that happened to me in those 4 years.
Sure.
It's just trying to, I'm doing consulting. I have some very fun projects going, and I really do want to try to build a national coalition. I'm
Okay.
looking for all the help I can get. I would love to get back into the practice. My lawyers are still saying, let's just have some time pass. So
You've been battered. Both of you have been battered. Yes.
but you know what? We're strong, and we're gonna we're gonna make this. I think we're not victims, we're victors.
I like
and I
that.
always say success is the best revenge. I had a wonderful grandfather. Success is the best revenge. We will be successful, and we're going to own this, and we're going to keep pushing it till my dying day. I'm not going to let the status quo go on. So
That's
but
a
I
great
miss-
t-shirt. That's a
I
good
really,
t-shirt.
I really miss you, patients. So I'll start crying. Thank you for staying in touch. I love you guys. So we're in this together.
Well, I know,
I know
Cammie,
we're all.
there's one thing you wanted to touch on, and then I think after that we can wrap up. But I can already tell that we will have the two of you back on in a future live stream.
Anytime.
We could keep going for another hour.
There-
Absolutely. There's so much to talk about.
Right.
We'll start
I'd
dancing.
be-
We'll do a little.
We'd be more than honored to be back. There's so many
Absolutely.
things because this is such a complex issue.
We love our pain
And,
patients too.
One of the things, and I do want to do this, it's not only the intractable pain bill and or the amendment to the existing intractable pain statute that we accomplished in Minnesota. And it wasn't just me, it wasn't just Dr. Hess, there was
Exactly.
so many other people
So
involved, and
many
you
people.
need more people, and it's still in Minnesota. If you want to help, we need the help.
Please.
What we were able to do, even back in 2019, we were able to get, they didn't have chronic pain patients on the opioid prescribing work group. They didn't even have a pain management physician. They didn't have an anesthesiologist. They didn't have a
It's
hematologist.
Shocking.
They
Actually.
didn't have people with disabilities represented. They didn't have people with rare diseases represented. We actually had Tim Boyd from NORD back in 2018 attend a meeting at my request in the state of Minnesota at the opioid work group and offered assistance from NORD, and they turned him down. Now, this was to represent people with rare diseases, including but not limited to CRPS and things like that involve such extreme pain. They turned it down. We tried to get the Rare Disease Advisory Council, which is now under the Minnesota Council of Disabilities, but it wasn't at the time. We tried to get them a seat at the table. Pain management physician specialist a seat at the table. We were able to get finally, after years,
Finally.
2 chronic pain patients as part of the opioid work group. Now, the opioid work group was established in Minnesota in 2015, the end of 2015. It took until the end of 2020 or the 2020 legislation to get it added to the statute that included pain patients. Now, so we had a seat at the table. Now you could attend the meetings and you could make comments, but you're pretty much blown off. And I have no problem saying that because that's the absolute truth. Now, I did have some good conversations with some people in Minnesota, but other people still despise me to this day. And I don't care because I'm on the right of this, and I'm going to die on this hill. So we added those people and we fought for that. We testified to it and we talked to the legislators and we were able to get them added. We got a pain patient, whether it was chronic pain, intractable pain, rare diseases, added to the opioid epidemic response advisory council. So we had a seat at that table and still have a seat at that table. What we were able to do recently, this session, is the opioid prescribing improvement program. is the umbrella of the Minnesota prescribing guidelines and the quality improvement program. The quality improvement program is where they were sending out those report cards. And yes, physicians need to be mindful of what they're prescribing and their dosages and watch out for their patients, but they're threatening letters. And they're Medicaid
And they were
patients.
intimidating. It was intimidating. It, no matter what anyone tells you, let me give you the physician, the PAMP, it sent a chill to the medical community. Absolutely. And that's what I testified with the legislators, that this did have a massive impact, negative, for our poor patients.
And this program, they were being told, guided, instructed, I don't care what the term was, but if you don't do this, you could be disenrolled, you can be decredentialed. There were threats involved in this.
Oh, yeah.
And so the Medicaid population was being treated differently than the private insurance population. And right in Minnesota, and my voice is getting a little up there, and I'm sorry, but I'm very passionate about this. Right in the agreement, and for the Medicaid to take Medicaid patients, you have to agree that you will treat them, your patients, the same, regardless of the fact if they're on Medicaid or Minnesota Care or have Blue Cross Blue Shield. But this program, if you didn't taper your patient, you're getting threats.
You'll be disenrolled too. You'll be, I was decredentialed.
You can be disenrolled
multiple times from an insurer.
That is coming to an end. That program is going to sunset in is going to sunset in 2024. December
that was
2024 is the absolute hard date. And it could be even earlier than that. Now there's going to be a waiver in place. There's going to be other things happening, but the report cards and the threats and whatever they want to call it, guidance, or why can't you do this? Why aren't you successful? That's going to be stopping. And so the discriminatory practices against the Medicaid population, which is already vulnerable, is going to come to a stop. And that was a hard fight this session.
Huge fight this session.
We were successful, and it was not just us that did it.
Was
MMA.
a team. We had great AMA, a lot of really good. And I think, Jim, that's your point too. This is is this making a difference? You're not going to see it the first, I think each little milestone we do, and it's never fast enough for those who are in pain. We get it, you guys, but know that we're there and know that each piece, like you said, Cammie, now, and then next year that sunsets, and then we're just going to keep right at it. Yeah. So, and then hopefully then with those letters not coming out, hopefully doctors and nurses won't feel so, looking
over their shoulder.
Yeah. Well, that's what the AMA said too. The AMA sent an amazing letter saying this is a doctor-patient relationship. Get out. That letter was extraordinary, Cammie, wasn't it? That made a big difference. Doing that. President of the MMA, testified with us for us. We need everybody. This is between us and our patients. Period. Yeah.
It's a continuing success story.
Exactly. We have to do it too. And that's why I know we know the frustration. We live the frustration.
Yeah.
But don't give up. Please don't give up. Please.
Ms. Johnson, anything else?
I think that is it. But like I said, the two of you have a lot of fans in the comments and people who I know are going to want to get in contact with you. So like I said, send our Facebook page a message if you're interested in getting in contact with our guests, because they said they are open to it. So definitely.
Here's the problem. I am terrible with Facebook and LinkedIn. So I'll need help. I'll have to get my 6-year-old granddaughter involved, and Cammie knows.
I'll help you, as I always do.
Cammie, how do I attach to that? And I'm like, I'm really good at this. I can get the brain. I know exactly the pain processes, at a PhD level. I can't send a damn email to Cammie. She's just like, so be patient with me. It's not that I'm ignoring you. It's I don't know how the hell to do it. So
just CC Cammie at all correspondence.
There you go.
Yes.
Cammie will tell you.
Yeah, and then if we can, I know we went way over time, and I apologize for that. I tend to get wordy. It just shows I'm passionate about this and helping other people. But there was that survey, and it's a questionnaire, and I did send some information. I don't know how to share my screen. I'm sorry. But there was a questionnaire. It's about patient abandonment, forced tapers, why it happened, what your doctor told you, and that information is being gathered. and it's being put out by the Doctor Patient Forum. And I'm not affiliated with them, but I do help on this project, and I will help other organizations with other projects. I prefer to stay behind the scenes on things. That's just me. But this is an important questionnaire, and it can be used to speak with legislators. I sent some
Exactly.
graphs, very disturbing outcomes of these.
Very disturbing.
If you can show the charts, there's a link to the survey if people want to take it. 62 people who responded had CRPS 1 or CRPS 2. And so if people want to take the survey, it will help this cause. So that's why I would like to put that out there.
We
And then
definitely
put it in
will
the chat.
support you.
Yeah,
We'll
and
do
I
it.
think, like Cammie said, please, even if it's just a survey, because when we go to legislators, if we come empty-handed, hat in hand, it's just the Todd and Cammie show. That's not what this is about. This is the pain community coming together, coalesce, work, even looking at how we can data mine amongst ourselves to help ourselves. So don't ignore these surveys. They honestly mean something. I'm not kidding. So please answer stuff when you get it. We appreciate it.
I'll be quiet now. Thank you. I'm so honored to be part of this and to be invited to this.
So
I'm like getting choked up.
we love
We
you guys.
definitely appreciate having both of
We're
you.
family.
I did add the questionnaire results to the chat. So there's so many resources in the chat, and they're also going to be on
Good.
our website. So really, more to come, definitely. But
Amen.
I want to thank both of you all for joining us here this evening.
Pleasure.
And as always, because we did have some people message us and say, hey, I can't make this live. How do I rewatch it? So of course, as you all know, this video will be pinned to the top of our Facebook timeline
Okay.
for easy access if you want to rewatch it. And we are also going to add it to our YouTube channel. We will of course
Excellent.
add all the
Thank
links
you.
that we mentioned during this Zoom to our YouTube channel as well. So as always, if you have any questions for us, if you need a support group, if you're looking for a new physician, or if you want to tell your story on the RSDSA blog, please send us an email at
Wonderful.
info@sds.org. Have a great evening, and thank you both for joining us.
Yes.
You're
And
not
thank
alone.
you to you guys and Jim for
Keep-
RSDSA. I learned
keep
a lot
fighting.
from you. Thank you.
It's our pleasure. Listen, have a great evening, and we
Sure.
will keep in touch.
Oh, yes.
Thank
We're
you.
gonna
We'd love that.
build that coalition. Alexis, as always,
Absolutely.
thank you, dear.